of volunteer engagement with Heart to Heart, which we'll talk a little bit about what that means. And then I also have with me Heather, and I'll let Heather introduce herself.
Good morning, everybody. I'm Heather Lee, as you guys can see, and I am the Director of Disaster Response for Heart to Heart International.
And we have Sarah Cooper, who is joining us. This is actually Sarah's first day with Heart to Heart. So Sarah is our new volunteer coordinator. And Jace and Curtis, I won't make you guys talk, but thanks for joining us. We wanted just to give a brief overview of Heart to Heart and what we do, the work that we do, both in and around Kansas City in the US, and then also across the globe. And then Heather is going to also share specifically about the work that we've been doing around COVID-19 and opportunities, a new program that we're rolling out for people to participate in with that. So I will kick us off here with just an overview of Heart to Heart. Heart to Heart is a global humanitarian organization, and our primary goal really is to increase access to healthcare. So everything we do is focused on healthcare. We do that primarily through product distribution, disaster response, various trainings, and different laboratory programs. And really, we embody three strategic pillars, as we refer to them, and how we go about doing our work. So those three are product distribution, disaster response, and volunteerism. So I'll give you a quick overview of those three things. Product distribution, basically we have a giant warehouse in Lenexa, Kansas, which we receive donations of medical supplies and pharmaceuticals. We get those donations from all the leading pharmaceutical and medical companies donate product to us, comes to our warehouse. We have volunteers who sort through all of that information, and then that is available to clinics and various medical groups, both within the US as well as around the world. So to give you a little context for that, so we send out all of that stuff around the world. And last year, we shipped out over $200 million worth of supplies. So kind of a cool program where our different partners who are vetted can go online, see what we have in an inventory, and then make orders, and we'll send that out. We've been doing that since 1992, and since then have distributed over $2 billion of supplies. So that is one primary area that we focus on, is product distribution. The other is disaster response, which is Heather's primary area. So we have a disaster response team, both paid staff who work here in Lenexa out of our office, and then also a group of volunteers. So what they do is they provide medical care in the wake of a disaster. So we have a roster of medical professionals who are able to deploy anywhere in the country or around the world. That roster is made up entirely of volunteers, so doctors, nurses, EMTs, paramedics, that sort of thing, who give up their time and skills to ensure that the survivors of a disaster have necessary health care. So if you think about last week, Hurricane Delta hit Louisiana. So Heather was watching the weather, was in conversation with a lot of different organizations and partners that Heart to Heart has, assessing needs to figure out, is there a healthcare need? Do we need to send healthcare professionals? We responded to Hurricane Dorian last year, which hit the Bahamas. It was a catastrophic hurricane that really decimated a lot of that area. And at one point, Heart to Heart was the only organization providing healthcare to the people who were still on one of the islands specifically. So that sort of thing, it's usually earthquake, usually sudden onset disasters like earthquakes or hurricanes or that sort of thing, but can also be man-made disasters. We've done things along the border in the U.S. With the border crisis, as well as infectious disease, which Heather will talk a little bit more about with COVID-19. The third strategic pillar is volunteerism. So Heart to Heart was founded really on the principle of volunteerism and wanting to incorporate volunteers into everything we do. So we're always looking to bring more people on board and do that in all of our program areas. So with that, I'll kick it to Heather, and she will talk a little bit about COVID-19 projects.
Okay, good morning. With COVID-19, it has been a really unique challenge for not just Heart to Heart International, but truly nonprofit disaster response organizations across the board. And for many reasons. One, we're now faced with a new threat. So having a primarily volunteer group and a volunteer-driven mission, now we have to kind of think through, okay, what risks are we putting our volunteers in? And especially for a disaster response team, if you're deploying into a new area, we have to think about the spread of COVID, not just to our own volunteers, but also to the communities in which we're serving. So it really adds another layer of complexity into determining whether or not we can respond. And it also makes us, forces us to become fairly creative in new ways to respond. And so as a healthcare organization, we have to respond to COVID-19. It is a health threat that we're facing, and how can we do that and respond in a safe way? And so we've really kind of branched out in multiple different projects across. We started working more locally within our Kansas City area. We've been supporting primarily in the Kansas City metro area, the population that's experiencing homelessness. So we set up clinical services outside of a homeless assistance campus and have been doing that since April. And we've had over 680 patient encounters just since April. So one, trying to prevent the spread, and two, and then also offload the burdens that the healthcare facilities are facing. We've also started doing testing programs. So we have our labs department that's now doing COVID testing multiple days a week, offering that through the entire Kansas City metro area. And then finally, we're doing an education program. And this is an opportunity that we can speak about in ways that you can get involved. We do and are just starting, actually yesterday was our kickoff for the Student Ambassador Program, in which there's online modules that you can take, and then that gives you the background about COVID-19, education on spread of COVID-19 and prevention, and then you'll have an opportunity to join a live Zoom session with our curriculum developers and also folks that have specialized in this area, where you can develop a community action plan. So it's a way for people within their community to gain the tools to best assist their community and some of the unique ways and unique needs within your community, and identifying those and helping prevent the spread of COVID-19 and also educating those around you. So if anyone's interested, please don't hesitate to reach out to us. We have an email, and I can share the information later. We have like a little pamphlet on how to get involved. But if that's something that is of interest, we highly recommend that you take a look at it, or at least get some more information. So I know our time is up, but really enjoyed being able to talk to you guys a little bit about what we're doing.
Thanks, Heather. We don't currently have anybody else waiting to jump in for the next session. So Curtis and Jace, if you guys have any questions, feel free to either throw those in the chat or unmute yourselves. Happy to answer any questions you might have about Heart to Heart. We're ready.
Go ahead, Jace.
All right. I don't know if you can hear me.
You can.
Okay, sweet. Sorry, I'm having connection problems. But so I have quite a bit of questions. So how many volunteers do you have? That's my first question.
Yeah, that's a great question. So annually, we have over 10,000 volunteers. We have a core group A lot of those are just one-time volunteers for an event. We do have a core group of volunteers that's probably closer to a few hundred of people who are in our space regularly and regularly volunteering with us.
All right. How have the volunteers had an impact globally with the natural disasters going on while having to deal with the global pandemic occurring? Like how have they made the mistake while having to outmatch the pandemic? Confusing question.
I think you're kind of breaking up a little bit, Jace, but I think from what I understand, you're asking is how have our volunteers been able to make an impact internationally amidst this global pandemic? Is that right? That's a great question. I'll take a stab at it, and then Michelle, if you want to jump in and whatever. But so anyway, honestly, the truth is that it's been really tough. A huge barrier that we're facing is travel restrictions. So there's that. It's difficult. We actually have been trying to do a response in the Bahamas. We were responding in the Bahamas, and we had to leave because of COVID-19. And so we've been eager to get back, but the government keeps going back into shutdown mode, and not just shutdown mode from allowing people in, but also once they're there being on lockdown as well. And so we've had to kind of take a step back a little bit from our global deployments currently. And what we have been trying to do is support in different ways. So we've done training on COVID-19 and done instructional Zoom calls globally. And we've done that throughout many countries in Africa and some in the Caribbean as well. And we're looking to expand that. So it's really more, and I think that this will continue to be the trend, about how do you build capacity with people that are already in those different spaces, and how do you provide them the tools to be able to respond to the pandemic themselves, because the less travel we have, the lower chance we have of COVID spread. So that's not to say that we won't ever deploy. We just have to be a little more judicious in when we do decide to deploy, and respect the desires and the needs of each individual country as well. So so right now we've really only been able to impact since pandemic hit through training and product.
Yeah, I was going to say the same thing. Our volunteers have an impact. We have continued to have a core group of volunteers into our office and warehouse. And they are packaging supplies, sorting through stuff, and shipping it out, and then that goes all over. So even though they're just located in Lenexa, they're having an impact across the US and around the world. Any other questions, Jace?
That's all my questions.
Perfect.
So thank you for answering those.
Yeah, absolutely. Yeah, thanks for jumping in here. And with that, we will close it out. Hi, everybody. My name is Nichelle Kaufman, and I am with Heart to Heart International. Heart to Heart is a global humanitarian organization based out of Lenexa, Kansas. And everything we do is focused on access to healthcare. The primary ways that we work to increase access to health are through product distribution, as well as disaster response, and various different program areas, both within the US and globally, including laboratory programs and various trainings. So with product distribution, we receive medical donations from pharmaceutical and medical supply companies who send those supplies to our warehouse. We have volunteers who sort through that. That gets distributed all across the country and around the world. Additionally, with disaster response, we maintain a roster of volunteer medical professionals, doctors and nurses who are ready and able to provide healthcare services in the wake of a disaster like a hurricane, earthquake, or in the season we're in right now, infectious disease like COVID-19. We also supply and do training with a lot of different laboratory programs in the United States, and have done a lot of that around the world as well, and do a variety of different trainings and programs now specifically with COVID-19.
Thank you, Nichelle. Heart to Heart is of course based in Kansas City, but could you talk a little bit about the specific international events that you've helped with, or any international aid that you've provided?
Yeah, I'll share a few things, Heather, and then you can chime in with some of the responses that we've done. So internationally, we send medical supplies and pharmaceuticals all over the world. So we have sent product to over 130 countries, who really to outfit various clinics around the world. So that's a huge thing that we do internationally. We also have a program where we utilize corporate volunteers to do more significant projects in various countries. So we've done that in Haiti, we've done that in various places in Africa and China, where we embed volunteers in those areas to do training or various healthcare infrastructure improvements. So those are really the big things with that area. And then Heather will talk about responses we've done.
Yeah, sure. So we do still have an ongoing presence in Haiti. After the earthquake, we responded and then really never left. So we've had a variety of projects over the years. Most recently, we are still actively doing education revolving around COVID-19. So we have COVID-19 educators. We started in the various marketplaces throughout primarily the Patientville area, but also throughout other areas. And now we're moving into the schools as well to provide education. And we are also doing, we actually just started a WASH education training program as well that we'll be doing in the next few years. So we still have an actual HHI Haiti office there and continue to work. We also still do have an ongoing presence in the Bahamas. So right now we're not physically there, but we have been supporting various organizations, the Bahamian Psychological Association, to help provide and expand their telehealth phone line. So like they have a crisis hotline essentially. And so we're able to expand the hours that they're able to call. And then also they have Creole translators that we're funding as well. And we are planning on returning and continuing projects there. And then of course, throughout all the years, we've just had various responses internationally. So we sent a team to Mozambique after the tropical cyclone Idai. We went to Indonesia after the tsunami in Palu, and sent a small team into Guatemala after the volcano eruption. So that's just to name a few. Essentially, we've had various responses throughout the years, but Haiti is probably our primary location where we're still actively responding and have an active office since the earthquake.
Thank you.
Mhm.
And you talked extensively about the experience that volunteers have had internationally, but what I'm wondering what the average day looks like for an employee with Heart to Heart.
We could probably all answer that question differently.
Completely differently.
We often talk in terms of disaster season and non-disaster season around Heart to Heart, especially for those of us who have some hand in disaster response. So for myself, my job is mostly in the office. I sit at a computer. I'm emailing, making phone calls, keeping in regular contact with our volunteers, really organizational and strategic in nature. When there is a disaster, that remains the same. I'm still at a computer, but my body of work shifts to then exclusively be deploying those volunteers to the disaster zone and communication with them. So it's a lot of time on the phone. It's a lot of emails, a lot of sifting through information, securing logistical things for those volunteers and making sure that it's a smooth transition from the office to the field. So a typical day is is being in the office.
For me, it just, I don't think I ever have a typical day. And it really just depends on the disaster and what we have going on. I think it's more specifically now that we have COVID-19 responses, it's a little bit different because we do have ongoing active projects. So we have a medical team that works and provides direct patient care Tuesday, Thursday, and Friday. So we're working there physically, making sure that, we like just have like our nurses and our doctors and making sure they have the meds they need and all that. But then also continuously monitoring really the globe, to see if we have any disasters, especially during hurricane season. We're looking at any potential disturbance that could be developing into a hurricane so that we're prepared for that. And then we're also working on a classification certification project, which is through the World Health Organization. And that is a tremendous amount of work for us. We essentially need to create standard operating procedures, purchase equipment, and develop a lot of training so that we meet the standards for the World Health Organization to be a certified emergency medical team, which opens up a lot of doors for us. So it really is a lot of sitting at computers and just knocking out SOPs. And then of course, also, it takes a tremendous amount of connections to maintain, to be able to be relevant in this field. So most of our days really, yesterday, I think I had 8 Zoom meetings because we need to remain relevant within our local community. So we're on different like local Kansas City coordination calls. There's a voluntary organizations active in disaster coalition that we're part of, and there's state and national level plus different committees. So we have to be part of all of those. And then globally, we're part of the Pan American Health Organization. So we're making sure that we are participating in all of these various coordination calls so that if a disaster does occur, we have the right connections to be able to respond. And that does take quite a bit of work to maintain.
Great.
It's my birthday, so I have no idea what the future holds quite yet.
Okay. If you guys have any or resources or where students can find out more about Heart to Heart and you would like to plug them now, that would be awesome.
Yeah, our website, so hearttoheart.org, or Facebook, Instagram, LinkedIn, Twitter. And then Heather's also sharing information regarding a student ambassador program that we're currently in the process of launching that will hopefully be available through the IRC.
Yeah, and I will put a plug in for that training specifically. I think that specifically with COVID or any type of educational program, the information is transferred in a much more effective way if it comes from somebody within that community. And so by empowering students who are connected with their community, I think that they're more effectively able to educate the people around them and reach the communities better than we could as an outside entity. So this training program is not just, here's a PowerPoint presentation, take a look at it, and then you're done. It really provides students the skills to understand how to develop a training program, how to understand the needs within their community. And so I think it's beneficial not just to the community, but also to the student as well, because it gives them these tools that they'll be able to use far long into the future as they hopefully grow and develop and want to make an impact within the people that they reach as well. So it's a new training program, but we've hired some really great professionals who've worked on Zika campaigns in Puerto Rico and with the CDC. And so they've developed this training curriculum that I think will pay dividends, not just to the communities, but also the students as well. So I shared that information with Natalie, and hopefully we can pass that along.
Great. Well, thank you guys so much for your time today. And if you would like to learn more about Heart to Heart, we encourage you to visit their website or visit the IRC website. It's irckc.org. So thank you, everyone.